Okay, I'll just go ahead and start. I'm very excited for this webinar this evening. Thank you for joining us. I'll start off with just introducing our speaker and then talk a little bit about the background for the webinar, and then I'll hand it over to her. So Tasnim Ahmed is a journalist, a fourth-year Stanford medical student, and Global Health Media Fellow with the Stanford Center for Innovation in Global Health. She spent several months this year interning with CNN's health reporting team and has written numerous stories on topics from insulin shortages in Ukraine to abortion access in the US. She has also covered addiction and the opioid crisis for a local publication based in the Bay Area. Most recently, she covered reporting on limited morphine availability in Bangladesh. She is passionate about global health and has a research focus on maternal and child health. So this webinar is going to be highlighting how journalism can serve as a form of advocacy and how it gives a voice to underserved communities. So I'll hand it over to Tasnim. Thank you.
Thank you so much, Dr. D'Souza, for that introduction. Hi, everyone. My name is Tasnim. I'm a fourth-year student going into internal medicine. As Dr. D'Souza has mentioned, I spent this past year doing some medical journalism. I took a year out of my medical school to be able to do this, and it was, again, through this fellowship. So I'm really excited to be able to talk about this topic that is really dear to me. I think that global health reporting and storytelling is a great tool to be able to spread and information about some important global health topics. So hopefully I'll get to spend the next half hour talking about that. And I don't know, Naji, if you're able to share the slides. All right, we can go to the next slide. Before I talk about what I'm here for, I wanted to give a little bit more background about the fellowship that I did, because I think it's a really amazing opportunity for medical students who are interested in the intersection of journalism and global health to be able to actually do it while in medical school. The fellowship funds one student each year to be able to take first couple months doing some coursework in the Stanford master's program in journalism, followed by the 3-month internship at CNN's health team, which I got to do, as Dr. D'Souza mentioned. And then finally, the fellowship is capped off with a global health reporting of the applicant or of the fellow's own choice. And for me, that was morphine access in Bangladesh. The fellowship provided me with funding to be able to travel abroad and do the reporting in person, which is great. It's open to all medical students across the country. Only caveat is that you can't be in your last year of the fellowship of medical school. And the application for that will open up in around December, followed by several rounds of interviews, and then usually the fellow is told by mid-March whether or not they were able to get it. So anyway, if you're interested in that, I have the link here, and hopefully we can drop it. Yeah, I just saw that Dr. D'Souza dropped it in the chat. And feel free to reach out to me after if anybody has any questions about that. We can move on to the next slide. So the topic that I really want to talk about today is how we can use reporting as a form of advocacy when it comes to global health. I think when it comes to the news, there's obviously lots of topics that will inevitably make the news just because of the gravity of them. For example, the Queen dying, political events, whatnot. And then there's a subsect of the news that is made the news because people, journalists, decide that it's newsworthy. And I think global health is that sector of the news that we as providers can really make an impact on. And I think that's why we need to really diversify newsrooms in the first place, because we can bring in all these experiences that we have and share it within a much more public space. Global health being one of them, I think reporting allows us to highlight these topics that are so dear to us for a public audience. I think it's also a great way of making some very complex topics easily digestible for the layman, somebody who doesn't necessarily have a background in health as we do. Reporting is also a great way to provide people, individuals especially, with a platform for their story. So if you're working with people in different parts of the world, I think reporting is a great way to share whatever story that they have to say, focusing in on one individual in order to tell a much broader story. And in doing so, attracting stakeholders. And by that, I mean different NGOs. It could also be the government, policymakers, um, attracting funding. You know, people will not know that these issues are happening unless we tell them. And I think reporting and journalism is one of the most direct ways in which we as healthcare providers can do that. We can move on to the next slide. So I wanted to first go over some of the global health reporting that I got to do this past year. While I was at CNN Health, most of my reporting was on domestic health issues mainly, but as somebody who's really interested in global health, I also wanted to make sure that I got to do a little bit of global health reporting. One of those being the Ukrainian conflict, the Ukrainian war with Russia. And I remember when Russia first invaded Ukraine, obviously it took over the whole news cycle. Lots of people were talking about it, and we on the health team wanted to figure out, how can we, you know take up some space in this news cycle on the health issues that are relevant to the Ukrainian crisis right now. And so one of my colleagues reached out to a representative of Doctors Without Borders to just get an idea of what was going on. We went into this conversation without any agenda. We just wanted to know, what were they seeing on the ground. And the person we talked to was Kate White, and she discussed a lot of things that we did expect. For example, the spread of infectious diseases, people being worried about COVID-19 spreading. Polio was another concern. And one topic that really struck me that I hadn't seen anywhere was about the increase in the acute presentation of some very chronic diseases. Mainly, a lot of patients were coming in with uncontrolled diabetes because they just didn't have access to insulin. And I thought that was a really interesting thing because it highlighted sort of the more indirect casualties of this war. So I delved a little bit deeper into the topic, and I was able to get in contact with Valentina, who is the chairman of the Ukrainian Diabetes Foundation. And that interview was a very harrowing interview for me, because I remember while we were talking, she was constantly apologizing for the noise surrounding her. She was like, "I'm so sorry. I have bombs and missiles going on overhead." And I thought that really contextualized the whole story for me, to be able to talk to somebody who was facing this reality that for me was just sort of news articles or clips on TV. And as a journalist, that helped really bring a lot of emotion into the story for me. Through Valentina, I was able to get connected to an endocrinologist in Ukraine who told me a little bit more about what was going on in hospitals. And namely, the issue is that there were only two factories essentially that produced insulin in all of Ukraine, and both of them were located in Kiev. And so, unfortunately, that meant that people who were living in the eastern part of Ukraine were cut off from those supplies because roads were blocked, obviously, with the invasion. And as a result, lots and lots of people were getting hospitalized, and overwhelming an already overwhelmed health system. Once the story was published, I actually had somebody reach out to me and who said, I had no idea this was going on. I've started a GoFundMe to raise funds to help support this crisis and raise money for insulin in Ukraine. So, I mean, obviously, that's just one example, but I think it can really highlight how the mere fact of publishing stories about this topic can get people to be active in raising funds and raising awareness, and playing a role in helping to solve the problem. We can go to the next slide. The last project that I did during my fellowship for my capstone was on morphine availability in low and middle income countries. And for that, I decided to do specifically on Bangladesh. That's where I'm from. It's also where I've done most of my global health work. So the language is something that I felt comfortable with and familiar with as well. Um, and essentially, the idea came from me when I was talking to Dr. Keith Humphreys, who is a psychologist at Stanford and also chair of the Stanford Lancet Commission on the North American opioid crisis. And I was doing a story on that commission when he highlighted for me that while in much of the Western world, people are dealing with sort of the insidious nature of opioids due to overprescription. In lots of other parts of the world, it's almost the opposite problem, where people are so afraid of what can happen with opioids that there's a major taboo surrounding its prescription and its use. Governments have lots of restrictions on them, and a lot of it has been exacerbated by what's happening in the West. And so I thought that was a really interesting contrasting story, and one that I wasn't really aware of. Um, and so I decided to delve a little bit deeper into it. I talked to various experts in Bangladesh who, for example, Fazla Noor, who's on the right side of the screen, and I learned that in the entire country, there's only 10 hospitals that will um, disseminate oral morphine to patients. And all of those hospitals are located in just the capital city of Dhaka, which means that patients who are living outside of Dhaka have to travel hours and hours just to get their prescriptions filled, if they're even, prescribed it in the first place. And it was really alarming that there's so many patients who are living in pain when they didn't need to be. And so I decided to do a story on that, and I completed the reporting, and now I'm in the process of pitching it. But again, I think that sort of highlights the process that global health reporting can take you. While the Ukrainian story was something that I did completely remotely, this is a story that I did on the ground. I traveled there, got to see people face to face, and also take in elements of the environment there, visiting palliative care departments, pharmacies, whatnot, to really help color the story. We can go to the next slide. So I wanted to give a few tips on how to find stories for those who are interested in writing them. Inspiration for these stories can come from anywhere, but I wanted to give a couple pointers. For me, a lot of these stories just came from talking to people about stuff that they were interested in, and hearing about some specific stories and writing about them from there. So talking to local health organizations, it could be Doctors Without Borders, it could be other NGOs, it could be a local public health department. They're great sources for some interesting topics in healthcare that I think not a lot of people are aware of, because not a lot of people know to ask them. Another thing that I think is really helpful is getting to speak to a single person who has a really compelling story. We call this character-driven stories in journalism. And many of us have probably read it, where the article will start off highlighting one person's experience and their story with a greater issue, and sort of putting in information and other reporting as that story is told. It's a great way to sort of get people to be interested in the story. It's a great way to make it more relatable and relevant to folks when they have a face and a person, rather than just say numbers to connect to a specific topic. Another sort of helpful tip that I've liked is what I call like breaking news stories. Where are they now? A lot of times, stories that break the news don't stay in the news cycle for very long, obviously, because the news cycle is ever changing. That doesn't mean that those stories aren't important and still relevant. So what I like to think about is, what stories were breaking news maybe months ago, years ago, whatever it may be, and where are they now? What's going on? What are the developments that have been made since they first broke? For example, the New York Times recently published a piece where they go back and talk about the children who were affected by the Zika epidemic in 2015, and they look at what their experiences have been now and what governments and countries are doing about it now. And then finally, I think actually academic work, research is a really hot topic for news stories. People are always wanting to figure out what's sort of at the cutting edge of research, what are people looking into, and journalism is a really great way. Reporting, especially, is a great way to make some really complex academic topics interesting for the general public. I mean, obviously they're interesting to us, but to make sure that we get lots of other people interested, I think storytelling is one way to do that. We can go to the next slide. So now you have a story and you know what you want to write about. How do you go about doing that? Finding sources can be another obstacle in reporting. One thing that I found has been really helpful is social media, and I say that as somebody who's not very good at social media at all. But I use Twitter actually quite a bit when I was writing for CNN, especially to be able to connect with people who were affected by the stories I was writing on. And all I would do is sort of, type up a couple of keywords into the search bar and see what people were saying. And the nice thing is that if somebody is willing to share their story on Twitter, they're probably also likely to share their story with a journalist. So definitely would recommend social media. It's also a great way to connect with people who are far away from you. So when you're doing global health reporting, for example, people are constantly using social media in order to share their experiences. The other thing is you always utilize your network. I found that I used the institutions that I was a part of quite a bit in my reporting. For the story that I did in Bangladesh, I reached out to a researcher that I knew happened to be doing research in Bangladesh. Her field was completely unrelated to what I was doing. But I just asked, like, do you happen to know any experts in palliative medicine and addiction medicine? And she was able to connect me to some sources through there. And those sources will lead to other sources. I always end my interviews with two questions. One, is there anything that we haven't talked about that you think would be important for me to note? And the second question is there anybody else that you think would be helpful for me to speak to? And usually from there, you're going to get one or two other people at least. And it's great because then you can reach out to them and say, I spoke to so-and-so and they recommended that I speak to you. And then finally, I felt I didn't realize this, but lots of organizations have media relations teams, and their whole purpose is to connect journalists with experts in their organization who are trained in being able to talk to journalists. And it's a great resource to use if you don't have like a specific name in mind. So I reached out to the media relations folks when I was needed to talk to somebody from the World Health Organization or the American Heart Association, so on and so on. And it's a really helpful way to get to some awesome experts in these organizations. We can go to the next slide. And then finally, you have your story, you got your pitch. You want to make sure that people read it. And that's when it comes to the pitching phase, which I think is maybe one of the hardest parts, is getting some people to publish your pieces. Obviously, if you're already a part of an institution, that's a great way to be able to post it on your institution's website, whatever that may be. Or if you want to publish your work in different outlets that might have more generalized readership. These are some examples that I think would be really helpful. Obviously, Johns Hopkins has their Global Health Now, which does some really great global health reporting. Goats and Soda is NPR's global health blog. And I think they're also open to taking pitches sometimes. Stat Medicine, which I think a lot of us are probably familiar with, they tend to do more domestic domestic health pieces, but I always think it's worth a shot. Kaiser Health Network is another one, and I think they also tend to focus more on domestic health policies. But if you're, say, covering a topic that can sort of connect domestic and global health, then it might be a really good outlet. Obviously, there's also sort of the bigger fields, New York Times, Washington Post, Atlantic. Those are a little bit tougher. But I say it's always worth a shot. When pitching, it's always important to say why you're best suited for this. So if you're a physician, if you're a resident, include that. It gives you a lot more credibility. And then why the topic is important is also really important. You can also give them a deadline for how long you are willing to wait before they respond to you, before moving on to the next outlet. But it is an arduous process. I'm going through it right now, and it's one of those things where I would say just keep going, don't give up. And then we can go to the next slide. And I just wanted to end this piece on some good journalism behaviors. Journalism is all about sharing the truth, and so that means that we have to be honest in our reporting. With that also comes objectivity. And I know that objectivity in journalism can kind of stir lots of debate. I also know that it might sound a little contradictory because I've just said how we should be using reporting as advocacy. And the way I like to think of it is by drawing a parallel between reporting with how we as providers treat our patients. As physicians, we will gather the primary data, whatever labs, images, we'll include clinical trials, other research to paint a picture for our patients about their health. In doing so, we provide them with as much information as possible to make decisions regarding their health. And in doing so, we need to make sure that we're upkeeping the four pillars of medicine: non-maleficence, beneficence, social justice, and autonomy. Making sure that we are just preparing our patients to make their own choice, but the best choice given what the objective data is. And I think journalism is the same, where it's our responsibility as reporters to be able to provide the general public with the objective data, with as much information as possible, so that when they are making decisions, whether that be the way they vote, whether that be how they use their money or their own health behaviors, that they are making well-informed and smart decisions. I think that the pandemic especially highlighted just how important journalism is when it comes to public health and public policy. So many people were using what they heard on the news or what they read to influence their idea of the pandemic. So I think that really should emphasize why we need more and more experts to be making the news. When you are going about reporting, always important to ask for consent of your interviewees. I'm sure we've all heard of something being on the record. And that means that if something is on the record, then you are using a direct quote and attributing it to a person by their name and affiliation. So something like, quote, "Kids are amazing," said John Smith, member of the American Academy of Pediatrics. Then there's off the record, which means that you cannot use that quote whatsoever. However, you can use whatever they say to direct your reporting. And then there's this other thing called on background, which is where you can quote somebody, but not by name. However, you can use an affiliation. So you can say, "Kids are amazing," said a member of the American Academy of Pediatrics. That way you're kind of maintaining some level of anonymity. Second, always make sure that you get more than one source. Just like when we're doing our studies, you want to make sure that you're not just using data from one experiment, you do multiple experiments. Same thing with journalism. You make sure that you're corroborating your story with multiple sources. And then finally, being able to establish importance. Why is this topic important? Why should people be reading about it? Why is it relevant? Always great if there's a way to connect it with something that's already topical. And this is especially important when you're going to be pitching. these pieces. But just knowing what's the greater message you're trying to tell with your story. And that concludes my talk. Um, I've left my email address if anybody wants to reach out for any questions, and I can also open the floor up right now for questions.
Great. Thank you so much, Tasnim. That was really interesting, and it's always good to hear. I see someone clapping. um, it's always nice to hear like from firsthand, like how you found a topic, went on the ground, or virtually kind of connected with people, and how do you make that into a story, and all the things to consider when making sure it's reliable and confidential, or how to portray your sources and everything. So thank you so much. I think we have a couple questions, so we'll go ahead and read the first one. So we have a question. From Dina says, have you always been interested in journalism and storytelling? Also, what are some obstacles and challenges you have faced during your fellowship and journalism experience?
Yeah, I feel like I tell everybody like I've been a journalist since I was a kid. I've been writing for my school's publications since like middle school, and so definitely have always wanted to do journalism. And it was a really difficult decision actually deciding between journalism and medicine in college. And I'm glad that I did medicine because it enables me to do both. And actually, I will say that if anything, it helps actually give me a leg up in the journalism world because I come with a very unique background that not a lot of journalists have. Um, in terms of obstacles in my journalism experience, one thing that I had faced was um, often I think people who are in charge of the news will have a certain idea of how a story should be written. And I think that we as providers and physicians have a responsibility to make sure that we're always telling an accurate story. So I can say like one example for I was reporting on a study where it was like it showed that COVID-19 infection was associated with an increase in diabetes um, diagnoses. And my editor really wanted me to find somebody who had gotten diabetes after getting COVID. And it was tricky because I also didn't want to then make it seem like it was a causation. Like, not everybody who gets COVID is going to get diabetes. And there's no real way, right, to tell that that person who got diabetes got it because they had COVID. Um, and so definitely there were times where I had to sort of navigate the scientific mind with whatever the journalism world wanted. And at the end, I kind of compromised. I was able to interview somebody who had diabetes, had been diagnosed with diabetes after they got COVID, but then kind of put like a disclaimer where I was like, this doesn't mean they got diabetes because they had COVID. However, we are seeing more and more people with diabetes and then use that as a transition. So just being responsible with the reporting can be challenging.
Great, thanks. I'll go to the next question. So, a lot of people are saying excellent presentation, and so thank you. One question about when you pitch a piece to a national publication, for example, how do you first contact them, and how long do you give the publication to respond? Like you mentioned, give a deadline.
Yeah, so if you can find an email for an editor, I would say that's a great way. Um, and that I often can do through like just a peripheral Google search. Um, or or if that's not available, lots of news store or outlets will have a website or a link to how to edit or how to pitch stories. So, for example, I know like the Atlantic has a website where they show where you can pitch stories for different sections. So you can send an email there. I mean, if you can email a person instead of some general email, I think that's always the best way to go. That's not always the case, but I would prioritize trying to get a person's email first and then going from there. And then I forgot what how long do I give? Um, the I will end my pitches by saying like, hi, please let me know by the end of this week if you are interested in my writing. And then you're like, if they haven't responded in a few days, I think it's totally fine to bump the email. Just be like, hey, um, just following up with my last email. Would you still be interested in this story? And then I think if you give that, then you're like free to move on to the next outlet.
Great, thanks. That's helpful. Next question we have is someone said, your work is so impressive. How do you recommend a general pediatrician in New York City get started with storytelling and journalism with their local news outlets and even larger ones like ABC, CNN, et cetera, to get their stories online and shared?
Yeah, I would say actually, if you're an attending, it's probably much easier because you have the credentials and you can say, like, pediatrician so and so instead of poor medical student. So I'd say if you have an idea, formulate a pitch, do a couple of interviews so that you can say in your pitch, like, I've talked to so and so, and that way they know it's a legitimate story. And then you can send an email to, you can start small, I would say, if you don't have any portfolio, just so that you can build up a portfolio. So maybe starting with some more local publications first, um, and then getting some work out there first. And then that way, once you have built up a portfolio, when you move to try to get to some higher outlets, you can link to your work there and they know then that you have experience in writing and reporting, gives you a lot more credibility in that way. I think another piece of advice that I was told was if you are a part of an institution, one thing you can do is get in contact with the media team at your institution and let them know that you would be available to be interviewed by journalists or whatever, if ever the time comes up. And that way, the media relations team knows to reach out to you, especially, and knows that you have an interest in communications.
Great. A few other questions. So, can you talk more about what this portfolio would mean, or what do you include? How do you present it, or more details?
Yeah, absolutely. So the way I think about a portfolio is if you've published any articles anywhere. For me, like obviously before this fellowship, most of the places that I had published to had been either like my college publications, or very, very, I would say, like specific organizations. Like I wrote for the AAMC, and so I would include stuff like that. And so I think if you've done any writing that has been published, um, that can make up your portfolio. And I would specify writing that's more in the style of a news story. You could obviously link to maybe academic work that you've done, to show more maybe your expertise. But if you want to be more of a reporter, I would say, like news reports, op-eds can also work. But I will say that op-eds are a little different, like the structure and how you do them is a little bit different from news reports. However, if you are looking to do op-eds, I think that's also a really great approach. I think these news outlets are always looking to get some experienced voices. And if you say that you're a doctor, that you've worked with these patients, whatever, I think that holds a lot of weight. And that will probably be really interesting to editors.
Great. I think there was a question about speaking about editors. Can you describe the role of the editor in publishing, I guess?
Yeah. So the editor of usually whatever section you are writing to is going to decide whether or not that story is worth it and whether they want to back it to support it and have it published. Um, Lots of times the editor will also kind of tell you the direction they would like the story to go to. It's always great to be flexible because, especially in the beginning, because it is obviously their publication, so that you want to make sure that it fits with the style that they like. Um, and then in my sort of experience, editors are really helpful in guiding you whenever you have questions or are trying to figure out how to go about telling a story. And then you have a draft, and obviously the editor will edit that draft, ask you to do more interviews or talk with other people, and And so they play quite a big role in terms of shaping your piece. But I will say, like, there are some really great editors who will let you do your thing, and just give you the support to be able to do that. It depends kind of on the outlet, to be honest.
Okay, that makes sense. Sorry, going back to the portfolio too. Where do you collect your portfolio? Do you need a personal website or how do you present it, I guess?
Yeah, sorry. I feel like by saying portfolio, it's not like a physical thing. What I just mean is, like, if you have I don't have a website, I don't have anything like that, but I'm saying portfolio is more just like a metaphor for having experience in writing. So that way, when you're writing a pitch, for example, what I will do is I will link to articles that I've already written. And so then I can, the way that I structure my pitches is I will say, like, hi, I'm a medical student. I'm also a journalist, like I did this, and I want to write about this topic. And then I'll follow that with a little blurb about me, like 1 or 2 sentences, where I will say, I've also written a story on this, link that story, and this, link that story, um, provide more detail about whatever the story is, maybe spend a paragraph talking about who I talked to already, like interviews that I've already done. And then the last paragraph will just kind of be the more logistical aspects, like, please get back to me within this week. This is my phone number, email, so on.
Okay, great. Thanks. Someone is saying, are you accepting mentees? Florimon, the pediatrician in New York. So,
Oh my goodness, I feel like I'm a mentee. I'm the one who needs mentors. I'm happy to help anybody else who's also interested in learning about journalism and the intersection with health.
awesome. Another question from Michael. I understand you are a journalist, but could your talk also be applicable to stories shared via poetry?
Yeah, I myself have not done a lot of poetry, but I think really any narrative work that reaches people, gives people, evokes some sort of emotional response, humanizes the stuff that we're doing, is really important. And that, for me, that has been journalism. I've also written essays and so on. But for other people, if that is poetry, short stories, whatever it may be, I think that there's a huge place in medicine to really occupy with the humanities. And I think poetry is a great way to do that.
Another question, do you write the entire piece before you pitch it? Or is it more like an idea and then you kind of, maybe it depends?
Yeah, I think it sort of depends. With this particular story in Bangladesh, I ended up writing the piece because just of how my timeline was working. But I would actually recommend that people pitch the story before they write it, because depending on whatever outlet decides to publish the piece, they will want it to read a certain way, or maybe want to discuss certain topics. And it's always best to have know that as you go in to complete your reporting.
Another comment that as an attending, I can see you're going to go so far shedding light to right issues in healthcare. So great. I was wondering if you could just talk about how you foresee journalism fitting into your career, like during residency, short term, and yeah, less time obviously for it, but and then long term beyond.
Yeah, thank you so much for asking that question. I feel like I'll probably get that a lot as I go through the interview trail too. Um, to be honest, I'm not quite sure yet how it's going to look into my career. I definitely do want it to be a part of my career because it's so important to me. For residency, I feel like residents are so busy that I will probably focus on just trying to be as good of a doctor as I can be. That's sort of the advice I got, at least from my physician journalist mentors that I worked with, was to focus on becoming as good of a doctor so that when I do decide to do more in journalism, I have the experience to be able to put forward the best work. If I am able to, I would like to try to get maybe one story out a year just so that I can keep up the skills. And then as an attending, I would love if I could be like a medical correspondent for some news outlet. Um, I like doing reporting so much and doing my own reporting rather than being sort of like a pundit. Um, you know, and so I think I'd have to kind of pave my own path in a lot of ways, but I don't know. We'll see. We'll see what the future brings.
We'll stay tuned and keep an eye out for you. Nice. What resources do you have for people to improve their writing skills or how to develop those skills, I guess?
Ooh, that's a good one. I I would say for me, what has helped a lot has just been, and I feel like people probably hear this a lot, but just doing a lot of reading and reading stories that from outlets that I really aspire to, like this, the way the New York Times articles are written, for example, are just like to such a high quality. Um, so I think being able to use that is really helpful. I think being able to just like writing for the sake of writing without necessarily having a point to it is great because it's one of those things that I think is practice makes perfect. Um, and then I have a couple books which aren't coming to mind the names of them now. I wonder maybe I can send out or Dr. DeSouza, you can send out the email um, with these books that I had been assigned, at least when I was at the journalism program, that I found really, really helpful in helping to curate my own writing.
Yeah, that'll be great. Yeah, we can include it with the link to the recording to all the registrants. So another comment and question. So great to have a voice like yours in the public sphere, Tasnim. How do you think harsh, depressing stories can best be told such that people get engaged rather than just turn away?
Yeah, thank you so much. I think that is definitely a a challenge, and I think that if it depends on what your motive is, right? If a story is harsh, then that is the story's truth. And I think that we shouldn't try to sugarcoat it because it's taking away from the gravity of that story. And I think we want to do as much justice to the people who the story is about. Um, so I think, again, going back to we want to be as honest as possible and respectful as possible to the people that the story is about. And I think if it turns people away, um, you got to think about who it is that you want engaging with this, and I feel like the right people, the people who care about it, would not be turned away by something that is harsh. Um, I think another thing you can also think about doing is not just talking about all these awful things, but also talking about what solutions and what processes are people working on to help out. Sometimes the truth is that there isn't any solutions, or people aren't working on anything to help these really, really horrific stories or horrific events that are happening. And I think that in itself is a story, and I think that in itself means that people need to be involved. So I don't necessarily know if I would suggest trying to make harsh stories less harsh. Um, I think just being as truthful as possible is the best way to engage the right people.
Yeah, that's good insight. Thanks. I was wondering, it seems often global health issues, there's so many different ones that are like really important to different small populations. So how do you advocate for those topics to be covered, whereas the news cycle, especially in the US, is like dominant on domestic issues?
Yeah, that's a hard one, and it's something that I've encountered quite a bit. I like to try to find something to like topical to connect it to. So, for example, with the story that I've done on morphine access in Bangladesh, I um, connected it to how like essentially, I think the connection is that in the U.S. it's the opposite problem. Obviously, people are dealing with lots of addiction because opioids are more than available sometimes. And then what makes it more topical is the fact that Purdue Pharma, right, just went through like several different legal battles. And so it's definitely a topical issue. People are dying from fentanyl more and more every day. And I think that's the kind of peg that I put the story on, where I was like, okay, look, this is happening here, but what about what's going on in the rest of the world because of what's happening here? I think that's an interesting peg, and it kind of like uses something that people are already interested in to redirect them to a different part of what's going on in the rest of the world. You can do that, I think, with, I think, I'm trying to think of other global health topics. Even with like COVID-19, people were really curious to see how the rest of the world was dealing with it. And so I think there's one way or another, you can try to find a connection to what's going on here. And sometimes you don't need to. Sometimes I think the stories that are happening in the rest of the world can stand on their own and attract a lot of attention in that way. For example, like Ebola was a big deal, but like, was it a big deal in America? No. However, it was pretty severe. It was, I mean, very severe. And so that's why it made a lot of the headlines. Of course, I think the way that Ebola was reported on has its own issues. But just to say that I don't think everything necessarily needs to be connected to America in order for it to be interesting. But if it does have a connection, it's great to be able to use that.
Great. Kind of well, how do you keep up to date with what's going on in the world? There's so many news outlets. You mentioned some that are good for potentially pitching an idea and writing an article, but what about your news sources your favorite ones that you keep up to date?
Yeah. So I sign up for a lot of sort of like news alerts, the email newsletters that get sent around. So Stat has a really good one. Medicine Rounds is what I think they're called. I also Axios Vitals is really good. And then I think various other news outlets have their own versions of that. But I've often just kind of like, these are newsletters that will get sent out every morning, and they'll have kind of a collection of the stories that are really pertinent during that week or day. And so and they'll have like blurbs of it. So it's a really great way to get a peripheral read of some current events. I also follow lots of different organizations and big folks on Twitter, and I actually find like that I get a lot of my news that way. People that I like to follow are just, obviously the big like Eric Topels of the world, and Megan Rainey, so on and so on. People who are very public, people who are health communicators. I also follow like public health departments because I've often found that they will maybe issue out a statement or something that is newsworthy and will inspire a story from there. Another thing that might be helpful for people who are actively looking for stories is to sit in on meetings. So one of the stories that I ended up writing was on this in Gilroy County was having lots of people die of unintentional fentanyl use. And the story I ended up writing was about these mothers who had joined together to increase awareness because the county itself didn't seem to be doing much because they had all lost sons that way. And that was a story I actually found by attending a meeting with our public health department. One of the mothers happened to be speaking there. I followed up with her, and I learned so much about this story. So really, just attending local meetings is a great way to get access to some really cool stories.
Great. I was just wondering how, and we kind of talked a little bit about this, like writing an op-ed versus like a journalism article. Is that a good like stepping stone in a way, or it's sort of different, or how do you see those related?
Yeah. I think, I mean, I've also written opinions pieces, and I think it's a great way to sort of get your name out there for sure. And also to show that you have the writing chops. But I will say the process is very different. Even the structure is very different. But it's always helpful, even if you're writing an op-ed, to do your own reporting to support whatever it is that you're arguing. That definitely brings a lot of strength to the piece. I think the process to writing one and to pitching one might be a little bit different. I think often when you're writing an op-ed, if you're pitching one, you might already have it ready by the time you pitch, versus or reporting like a news story, the editor has a lot more influence, obviously, over that. Um, but yeah, I guess my overall advice is that if you are interested in writing, then you should just write. and get as much of it out there as possible.
Okay, I have another question. So thank you for all the info, Tasneem. When doing research on vulnerable populations, there are a lot of strict rules to follow. Are there similar principles within journalism and vulnerable populations? And if so, how do you tell a story about vulnerable populations while maintaining ethical principles?
Yeah, it's interesting because, obviously when we're doing scientific research with vulnerable populations, we go through a very rigorous like IRB process and so on. And I will say there isn't so much that in journalism. Obviously, a lot of it does require your own judgment, but when I have worked with more vulnerable populations, the way that I've gone about it is if I'm doing an interview and they say something that I find I will probably quote, then I ask them obviously for consent if I could use their quote. If for whatever reason I think that whatever they say could end up harming them, then I will try to protect them as much as possible. And so that might be a situation where you maybe keep their name anonymous, but keep their affiliation, so that you could still use the quote to tell the story, but maybe not put them in the spotlight. Um, the thing about journalism is that it's not as regimented as the way that science necessarily is. Um, and so I think it sort of is up to the judgment of journalists to do the best for their interviewees.
Great. Well, thank you so much. I think we got to all the questions, and I'll just go, Naji, if you could just go to the next few slides. Um, we're just going to advertise a couple of upcoming section on global health events. So next up is our, well, not next, but this talk we're going to have during our H program at the National Conference and Exhibition in Anaheim is going to be on Sunday, October 9th, and we're going to talk about applying a social justice and decolonization lens to global health photography. So I thought it was an interesting tie-in. This one was kind of about how to write about different issues in global health, and this is how to portray those responsibly through photography. So definitely keep an eye out for that. It'll be on Sunday during our H program. So next slide. We have one H program on that Sunday morning, and this will focus on highlight this presentation as well as some others and our abstract awards, and we'll have our poster presentations as well, and a business meeting where we'll talk about different things the section has been working on this year and what we have envisioned for the future and how you might be able to get involved. Um, and then the next slide is our day 2 H session. So this is in conjunction with the section on infectious diseases, and we're going to be talking about the impact of COVID on global health immunizations. And so that should be really interesting. We have a great lineup of different speakers. And then the last one is our next webinar, which is just before NCE, so just in about 2 weeks. And it's going to be on teaching principles of narrative medicine to promote physician wellness and resilience in a global health setting. So I'm really excited for this, a different way to channel your writing skills into a different, something within global health. And then there is a question about if these will be available remotely. So the webinar will obviously be similar to this. So remotely, we'll record it and it will be distributed to those who register. But the H programs, unfortunately, will not be streamed. I think, correct me if I'm wrong, Naji. Um, there are some live recordings that will be streamed virtually and then available as a recorded session afterwards, but I think the H programs will not be.
Correct. Yeah, the section on global health H programs will only be live in person and not recorded or streamed virtually.
Okay, great. So yeah, I think I actually forgot to introduce myself, but I think probably most people know who I am. So I'm Chiquita Paladisuza. I'm one of the education chairs on the section on Global Health Executive Committee. And these NCE sessions have been organized by my colleague, Dr. Heather Hawk. So we're really excited for you to participate and join for any of these that you're able to. And I'd just like to end off again with thanking Tasnim for such a really interesting and provocative discussion with a lot of helpful insight and motivation, inspiration for us. And also we're looking forward to seeing future articles that you write and where your career takes you. Thank you so much for sharing your evening with us.
Thank you so much, and thank you everyone for joining.
All right. Thanks. All right. Thanks, Tasneem. We'll
Bye.
end the recording. Thanks. Bye.
Have a good night, everyone.